from my previous work with the community of practice that my best advice to folks with coalitions who are looking to, build upon the success of other systems in their state is to diversify the folks who are involved in your coalition. I had a lot of questions after the last time I spoke about the different groups that were involved in our home visiting coalition. And I think the biggest question was about how is law enforcement involved in your coalition? And we work with this amazing group called Mission Readiness, and they are former law enforcement. We have former military folks who really understand the needs of families. They can see that we won't have a functioning military if we don't have kids who have safe home lives and good schooling and enough food. So it's really taking a different sort of view than your traditional child advocate. So really think outside the box. Think about who you can involve in your coalition who may be unexpected and may also have a close tie to legislators or administrations that you need to get involved with and who you need buy-in from. So I think that's my biggest piece of advice from a government affairs side of things.
Our work has not revolved around having to bring more folks to the table to convince the purse strings that this is a viable program. In some ways, I think that's very lucky that we have not had to do that. And also the possibility that we're one of the newer voices in this conversation that it may have lacked before. Right. So if you have a champion that has a lot of influence, but doesn't have the capacity to system build, and then you're asking, you're talking to the programs that are already sort of delivering it and in the thick of delivering it, it's hard to sort of envision a larger sort of system that supports more folks, that's statewide and equitable. And so I think a missing piece there was a collaborator, a facilitator of collaboration. And that is so often the role that we serve in our work, but especially here, right? Getting the providers in the public health districts to talk to the Division of Medicaid, to explain what their hangups were about how to build this, to be able to sort of push Medicaid as quickly as we did with our high-level champions, that were in alignment with our national technical assistance partners. That was sort of a missing piece to this work. There were all these pocket efforts, but not a coordinated one that folks